Thank you all for joining us for the Public Health in a Time of Crisis event. As George said, I'm Garrett Abrahamson, great class of 2007, MBA 2008, and president-elect of the Alumni Council. It's no doubt that public health has taken center stage of all of our lives this past year. And what we wanted to do is really bring together some different perspectives based on what Clark has done and how we've impacted our own community, but also at a national level, and two Clark alumni who have helped on a much larger scale during the pandemic. I'm thrilled you took time to join us, not only because of the topic, which is relevant for all of us, but also because it's a very special evening where we're going to celebrate the accomplishments of our very own Dr. Stephanie Bailey from the class of 1972. As I mentioned, I see that, 72, very nice. As I mentioned, we've gathered a great group together. I'm going to introduce each of them. They'll have a chance to speak, and then at the end, we'll open it up to Q&A with all of you. Now, Dr. Bailey told me that the introduction should be nice and short. Unfortunately, I'm not going to oblige. There is an incredible amount that she has done in her career, and want to share that with each one of you because she is tonight's honoree. She is the winner of Clark's 2021 Service to Society Award. That is a relatively new award, and it is what the Service to Society, there it is. So she's holding it up right there. Excellent. Yeah. And you can't, I can't just say, oh yes, and here's Dr. Stephanie Bailey. I have to tell you about what she has done. She's a lifetime champion of community health excellence. She was recently employed with the Meharry Medical College as the Senior Associate Dean for Public Health Practice. She, before that, served as the Dean of the College of Health Sciences and the Director of Public Health Initiatives at Tennessee State University from 2013 through 2016. And prior to that, she was, from 2006 to 2012, she was the Chief for Public Health Practice at the CDC, the Centers for Disease Control and Prevention, which we are all far too familiar with over the last year. She was an executive, part of the executive leadership of that agency that was responsible for assuring that the US public health system was strengthened, provided leadership in building and supporting a public health infrastructure, and really leading to improve overall public health systems across the country. Dr. Bailey held the position of Director of Health for the city of Nashville, Davidson County down in Tennessee, from 1985 to 2006. Part of her accomplishments, she really brought a national presence to MPHD, including the Bridges of Care, which was an access to care program, the first youth advisory board in the city back in 1996, the STD Free Coalition, and was the lead city department for the city's Managing for Results initiative. She was instrumental in the city's readiness for bioterrorism attacks. And back in 1995, she convened the first community strategic plan for Nashville that focused in on health issues. And it was appropriately titled, looking forward, Healthy Nashville 2000. It was then refreshed in 2001 to be Healthy Nashville 2010. Dr. Bailey has been honored locally, at the state level, nationally, as well as through many organizations. And I'm thrilled that tonight we get to honor her as her alma mater. She's had a chance to speak at all those different levels, including internationally. And she's been featured in a book that was authored by Carol Waltrig and Carol Barlas. It was titled Journey to Leadership, Profile of Women Leaders in Public Health. She's a published author and producer of the documentary entitled Through My Father's Eye. Her book, Remember, Recapture, Restore, Reclaim, and Preserve Principles for Living, is expected to be released this spring, hopefully out on Amazon, and we can all get ourselves a copy. Dr. Bailey, as it relates to Clark, received her BA in psychology before getting her MD from Meharry Medical College in Nashville. She did a residency in internal medicine at Grady Memorial, Emory University, also down in Atlanta, as well as Meharry Medical College. She later obtained her Master's of Science in Health Services Administration from the College of St. Francis in Illinois. Dr. Bailey is married to W.T. Bailey Jr. They have 3 children, 5 beautiful grandchildren. Six beautiful grandchildren now. Wonderful. I always think it's interesting that it's just children and then it's beautiful grandchildren. It always seems to happen. And to really round out the speaking points today, she describes her purpose in life to lift people up so they can soar. Before I introduce our other speakers, I want to take a moment to acknowledge Dr. Bailey, hold up that plaque one more time, her amazing career, her amazing accomplishments, and a Zoom round of applause to the Services Society Award winner from Clark. Wonderful. Awesome. Well, again, before I give Dr. Bailey a chance to speak, we are also joined by Clark history professor Doug Little, who was instrumental in conceiving and implementing the course Pandemic: From Horror to Hope for first-year students at Clark during the summer as they prepared to start college in a time like no other. We were talking before other people joined. I think, Doug, though, you adapted from your work that you did in 1918 with the influenza pandemic, correct? Yeah, okay. He'll be discussing what he discovered while thinking about that course, the different faculty that contributed to that, and what they learned while teaching the course. Joining those two, Vice President of Government and Community Relations, Jack Foley. Jack spearheaded Clark's response to COVID-19. He was instrumental in operationalizing the testing on campus, and he'll talk more about that, but if folks weren't keeping up with that, it was an incredible lift to make sure that, especially early on, testing was rolled out across the university. He took on the Healthy Clark Initiative and made it possible for students to continue their studies either in person or for those that chose remotely or through hybrid learning models. And last, I introduce a good friend of mine, Mary Owens, from the pretty good class of 1986. She's also the current president of Clark's Alumni Council. She's going to look at it from an angle of a pandemic response through corporate communications, through her role at CVS, why communication has played such a vital role during this time as such a key piece of getting through the pandemic. And so welcome again to our speakers. Welcome to all of you. Thank you for honoring Dr. Bailey this evening. And with that, I will turn it over to Professor Doug Little.
Well, thank you, Garrett. And it's great to be here and to see so many familiar faces. I wanted to thank Megan and George for inviting me to be part of this. And then I can't help but call you out, Garrett, as a former touch football buddy that used to toast me, as I recall, but I also see Ron Beck from the 1970s, who's got lots of experience with Clark admissions. I see John Winkleman from the 1980s, who I haven't seen in decades, so welcome to John. And I don't see Prima Srinivasan, but I know that the first year I was dean, she was the senior speaker. So it's really very pleasant to be among friends. It's kind of a Clark evening. So thank you all for that. Let me just take a few minutes to talk about this course that Garrett mentioned that we put on last summer, and then we did as a reprise during Clark's first intersession this past January, when we had a long break because of COVID, and we kind of kept our students engaged. But anyway, the genesis of the course is from last summer, and the genesis is really last spring. I think everybody in this Zoom room probably felt pretty glum last spring, whatever you were doing. We felt pretty glum here at Clark. I mean, I felt happy I was on sabbatical, but other than that, I felt glum. Classes had halted, faculty were isolated, students were isolated. We didn't have a commencement in the flesh. And some of us began to wonder how we would stay connected with our first year students who were not really Clarkies yet. They were Clarkies in becoming. And so a group of us got together and we did a little brainstorming. And we thought at first about kind of having some kind of online teach-in that would allow us to connect with first-year students and show them a little bit about how Clark worked and what we had to offer. But in a series of conversations with our dean of the college, Betsy Huang, she had the idea of offering a course for credit for half a unit, half a Clark unit during the summer to incoming Clark first year students. And our thinking was it would be online, that we would pre-record some lectures, that we would have live Zoom town hall meetings, that we would see how many students would be interested. And we began by thinking we'd have about 50 students interested. Well, when the email went out to the incoming class, we had 150 students interested, which was quite amazing, actually. Not amazing, maybe, but anyway, so we managed to winnow that down to about 100 students, and they all appeared in our Zoom classroom beginning in July of 2020. And they had a chance, I think, to see the Clark faculty in action, to get to know each other, and that's probably most important, and also to connect with Clark. What I thought I would try to do, one of the great things about this course was that all the faculty who were involved in it learned how to do Panopto, which is a way to record things, and to do Zoom, which is a way to be here tonight. But I'm going to try to see if I still know how to share screen so I can show you the, it's probably simplest to do it this way. I don't know if can everybody see the one pager that I just put up? So this is kind of a one-page summary of the course that we put together. It was put together by 12 Clark faculty. We came to call ourselves the Clark COVID Posse. We were from every corner of campus. As you can see from the little window there that has the participating faculty spelled out, we had Nathan Algren from biology. We had Pat Durr, the only faculty member who's been at Clark longer than I have right now, from philosophy. Ellen Foley from international development, Betsy Huang, English, Wim Kluster. You can see the list. We had somebody from screen studies. Yes, we had somebody from geography. And our thinking was that we would try to show students a couple of things. We would try to show them the value of a liberal arts education by indicating to them the connectedness of knowledge and the connectedness of the research and the teaching work that we were doing. And so we set up a sequence of pre-recorded lectures, and I'll scroll down. I always hate to do this because I know that it sends me into some sort of brain freeze when people scroll down on Zoom. But you can see the series of 11 episodes that we positioned in a sequence so that we could show students sort of the connectedness of knowledge. We began with an introduction, a historical overview, and a biological overview. Then we zoomed back to do the Black Death. We talked a bit about literature, science fiction, pandemics. We talked about the way that the 1918 influenza pandemic, and more importantly, the 15th century, 14th century Black Death pandemic were represented in art. Christina Wilson, if you haven't met her, is a great art historian that we have on board. We talked about geography. We talked about the ethics of vaccine and all of that. And we ended up with a session, episode 11, on where we were, what the future was likely to hold. And I think in the beginning, the students were overwhelmed. The faculty were in their element. We got to reconnect with each other. That was the selfish little reason that I think we all got involved in this project. But the students were a little overwhelmed. But by the time they got to about week 2, I think they began to see how things fit together. They had an opportunity on Thursday afternoons to be with the faculty and with their classmates in a live Zoom town hall where they could ask questions and ideally get a few answers. And certainly by the end of the term, I think they really felt they were part of the Clark community. And I think they'd gotten a feel, not exactly a real feel, but a sort of a feel for what it would be like to be in a Clark class. They had to submit a couple of papers, I think 3 short papers electronically. They had to post in our courseware platform called Moodle. They had to post in the forums. And so it really created a sense of community. It created a sense of buzz, I think. The last assignment was for them to make a video recording. I don't have one handy, and I'm not very good at showing video in a Zoom room, but the students went out and kind of put together videos that sort of expressed their experience and told us a little bit about what they'd gotten out of the course. And it was really quite delightful. And at the end of the course, we asked them to make a final post about how they felt about the course. And I think the best comment that we got was from a student from the West Coast, from the San Francisco Bay Area, who had come would eventually come to Clark. I got a chance to meet her, but she was Zooming in. And she said, the title of this course was Pandemic from Horror to Hope. And I came to the course with a lot of, if not horror, a lot of discomfort and a lot of concern about what was going to happen to me, what was going to happen to our country, what was going to happen to my education. And she said, I came out of it with a sense of community, and that's where the hope comes from. The fact that she could connect with classmates, the fact that she could do a little bit of reading, that she could do some posting online, that she could take part in Zoom town halls, that she could get to know faculty, sort of. We would hold live office hours on Tuesday afternoons so that students could connect. And so I think she came away with a sense that the whole purpose of the course was to create a sense of hope. And that was exactly what we set out to do. And I think the posse as a whole felt pretty good about it. We had extraordinary support from the administration, from Davis Baird, and from Betsy Huang. For those of you who have had any contact with our IT people, they were magnificent as well. They had to do a little bit of hand holding as we learned Zoom and as we learned Panopto. But it was kind of a preview for the students. This group of 100 first-year students was kind of a preview of what they might expect at Clark. And I think they came away satisfied. They came away connected. Faculty felt reconnected after having felt disconnected. And on the whole, we felt so good about it that we went ahead and offered it again in the intersession in January. And that was a little bit different. We didn't have just first-year students who were wet behind the ears. We had jaded Clarkies. I think the Zoom room is probably full of jaded Clarkies. I know that Garrett is a jaded Clarkie, or he was at one point. So it was a little different, but I think it was still successful because what it did was to keep students connected with us, with the faculty, with the university, at a time when they were home and distant from Clark. We had to end the fall semester just before Thanksgiving, and we didn't start up in the flesh. We didn't start up in the flesh until March the 4th. We didn't start the second semester until February 22nd. So I really think it was a lot of fun, and it was such a Clark deal because of the interdisciplinarity of it, the fact that historians were talking to biologists and anthropologists were talking to art historians. It was really great that way. And because of our small size, of our right size, I guess we say, at Clark, faculty knew each other, we could connect with our students, and we came away with a really good feeling. And I think the students did as well. So would I do it again if asked? Yes. Do I hope we don't ever have to do it again? Definitely. I hope we're to the other side of the pandemic. But it was a great ride. And as I say, it really felt Clarkish, if I can use an adjective that maybe is not in the Oxford English Dictionary yet, but should be. So I'll leave it at that. I'm happy to answer questions about content, but I didn't want to go too far off into the weeds. But a good time was had by all.
Wonderful. Well, thank you, Doug. And I do think you may say that you would be willing to do it again. I see there was a question if you would do a version for alumni. So there may be a clamoring to get that interdisciplinary opportunity out there, which would, like you said, is truly a Clark approach.
Well, the beauty of it is we have 11 pre-recorded episodes in the bag, so it wouldn't be a big ask to my colleagues who have already done the recording. But that's something, frankly, that we talked about last summer as a possibility. So that would be a neat thing. I'd be open to that for sure.
Very cool. Well, we'll talk to the right people on that one. But Doug, no, thank you so much, and appreciate not only what you did to pull that together, but sharing a little bit about it with all of us today. And next, I see he's off mute, so he's ready. I'd like to invite Vice President Jack Foley to share his response on sort of Clark's pandemic response more globally across the campus.
Thank you, Garrett. And I first want to congratulate Dr. Bailey for her well-deserved recognition tonight and for her work, particularly her work with youth. As many of you know, I have held many different jobs at Clark over these past 45 years, starting in the food services to having a role in Clark's nationally recognized work with our Maine South community. But I never had the opportunity to work in a pandemic. You can imagine my delight when then President-elect Fithian asked me in May of 2020 to lead Clark's efforts to manage the pandemic and safely reopen the campus to students, faculty, and staff. I do want to acknowledge the extraordinary leadership from President Fithian, stepping in last June to lead Clark through this crisis at the beginning of his time as president at the university. He set the tone early for Clark by stating that every decision made would be based singularly on the health and safety of the Clark community and our neighboring community. President Fithian established early in the process that faculty, staff, and students would have choices for being on campus in person or remote, and that we would be transparent in every decision that was made. By the numbers, we had 85% of the undergraduates and 55% of the graduate students in person for the fall, and just slightly fewer for the spring semester. Approximately 53% of the undergraduate courses were offered in person or in a hybrid model with some students in person and others online. 36% of the graduate courses had an in-person component. At Clark, as mentioned earlier, we have had a tremendous testing center operating since August 13th, testing 2,509 students every 3 days and nearly 500 faculty and staff weekly. Clark has conducted 157,710 tests with 159 positive results amongst 122 students, 5 faculty, and 32 staff. We placed 193 students who tested positive for the virus or were identified as close contacts into quarantine or isolation. Many students living off campus opted to quarantine in their apartments, and some students chose to go home. The approximate cost to Clark for the testing, staffing, additional financial aid for students, and physical adjustments to the campus has been around $9 million. Now, taking you back to last summer, I want to start by recognizing the overwhelming fear that was present. We are in a much better place now, but remember, when we were wiping down our mail, our groceries, and our newspapers. This is the context in which Clark was looking to educate ourselves about the steps to be taken to safely reopen. The primary component that must be present to successfully navigate a public health crisis such as the pandemic is collaboration. Although we can argue the level of collaboration experience in this country and across the world, collaboration was the critical element that enabled Clark to provide a different but still exceptional educational experience this past year. My first and my most important example of collaboration would be the faculty and staff who came together last June as the Clark Reopening Committee and have spent hundreds of hours since then developing plans for changing the way the institution operated and making the necessary modifications during the year that allowed us to be open and to keep our community safe. Subcommittees were created in primary operational areas such as academic, facilities, student life, business and financial, communications, and health and testing. This group has dedicated themselves 7 days a week to making sure that we had the operations right to support the community and to serve the students. Examples of these efforts include the de-densifying of classrooms, marking clearly the pathways and seating arrangements to follow in the classrooms, extensive new ventilation work, and enhanced sanitation across the campus by facilities management, and the creation of a highly effective testing and quarantine operation within just a few short weeks. The Clark Reopening Committee made 2 decisions during the summer that proved absolutely prescient. As Doug had mentioned, our academic calendar for 2021 was modified, projecting accurately that the virus would grow during the November and December holidays. Thus, we plan to end the fall term for in-person learning on November 20th and not begin the spring semester until February 22nd. This determination paid great dividends as Clark avoided much of the holiday winter surge, although we did send students home 3 days early in November when the virus was growing dramatically in the Worcester community. The second decision was recognizing the research early last summer that the transmission of the virus was primarily through aerosols. We modified many of our buildings with improved ventilation, the installation of fans, modifications to the length of time in class, and again, the de-densification of the classrooms. As one example of the challenge faced with the classrooms that may resonate with all of you, the Jefferson Academic Center 320 lecture hall that typically seats 300 could only accommodate 50 students spaced far apart. The assignment of classrooms was made a bit easier with about 50% of the courses taught online. Clark also reached out to bring medical professionals to our discussions and decisions by hiring a chief health officer who has been with us since last June and contracting with a local epidemiologist. Another important area of collaboration is with our higher education colleagues. As everyone was desperately searching for some direction for planning last June, Johns Hopkins University, along with other contributors, produced the COVID-19 Planning Guide and Self-Assessment for Higher Education. This was an extensive 97-page narrative and checklist that we followed diligently in those first few months, making sure that we were prepared to open safely. In Massachusetts, a higher education working group with representatives from the largest private institutions was created to work with the state to provide essential guidance for reopening campuses safely. Most critically, this group was able to collaborate with the Broad Institute to develop accurate, affordable, and timely testing results. It was recognized early in the planning process that higher education institutions would not be able to open unless there was frequent surveillance testing on campus with accurate test results within 24 hours to allow for the necessary contact tracing and quarantining of those impacted. Broad delivered. Broad began their work in July to restructure their laboratory in Cambridge to accommodate the tremendous demand, and by August 13th, they were in operation. Broad's testing program has served more than 100 higher education institutions throughout New England and Eastern New York State, and have now conducted more than 19 million tests at $25 per test with results in less than 24 hours. In Worcester, there were further examples of collaboration. The city's elected and appointed leaders and the local Department of Public Health have been on the front lines of this pandemic since the first week. But they have been meeting with all the colleges and universities in the city, providing the support and guidance needed to protect our campuses and the Worcester community. We were also fortunate in Worcester to have 11 colleges and universities that have been meeting every 2 weeks since last June to share plans, share best practices, and talk through many of the similar challenges facing each campus. Along with being a bi-weekly therapy session for me, we have all benefited tremendously from this cohort of practice. The last critically important area of collaboration in this public health crisis has been the willingness of the faculty, staff, and students to listen to the guidance, to learn from the science and the experiences of others, and to follow prescribed guidelines that will keep individuals and the community safe. This began at Clark with the Clark Commitment, a statement where everyone was asked to acknowledge their personal responsibility for keeping others safe and to fulfill the expectations outlined with social distancing, mask wearing, testing, and contact tracing. This commitment was the key to Clark's success, and the community embraced it enthusiastically. The overriding theme all year has been the importance of keeping the levels of infection low so that students could remain on campus for both the educational and the social experiences. The Clark community recognized the mental health benefits of students being on campus and worked hard to maintain that low level of virus. Faculty encouraged students from their bully pulpits in the classroom, and students applied peer pressure on other students to maintain these guidelines. Of course, we had our struggles with a few occasions when students were not in compliance, but honest contact tracing and quick quarantine for those students impacted controlled any significant spread across the campus. As we approach the end of the academic year with an in-person commencement and look forward to a new academic year that will be much closer to what the educational and social experience for students at Clark has been in the past, I see the past year as reflective of my experiences at Clark these many years. I have always seen at Clark that when the challenges are at their greatest and we need everyone to step up and work together, that is when the real power of Clark comes forward. This is a remarkable community that has dedicated itself to learn about the pandemic, operate in a manner to keep everyone safe, and provide tremendous support to our faculty, our staff, our students, and our neighbors along the way. Thank you.
Well said, Jack. Thank you for that that closing sentence to tie it all together, right? It was a year's worth of effort, but it was decades worth, built on decades worth of institutional commitment to all those important things. And thank you for reminding me about the wiping down of mail and groceries. We still have our tape in the garage, which was the quarantine area. So I had forgotten for a while, but thanks for that, Jack. Wonderful. I think that's a great, Doug sort of teed it up what we were thinking or what happened on campus with first year students. Jack looking at the campus as a whole and really that commitment again to public health at the campus level. Now I'd like to turn our attention to what Clark created through alumni and what they've been doing out in the world with that same type of commitment that was fostered on the Clark campus. So first, I'd like to welcome and invite tonight's honoree, Dr. Stephanie Bailey, to share her perspective and work as a public health expert.
Well, first of all, I need to thank Clark for the magnificent honor. I am deeply and humbly appreciative. My resume has two statements on it. One you heard earlier. One is my purpose in life is to lift people up so that they can soar. And that has been confirmed over the years for me that is my purpose. And the other one is that I am an agent for healing, who by permission is showing up every day to serve and be used. So to receive a service to society award could not be more honoring and a testament to my life's journey. So I do thank you very, very much. So I'm going to cover about 3 topics in about the remaining 9.5 minutes, given that I had to thank you first. And one is about my career. I was asked to sort of speak about that. And like many of you, you started out in high school with a pathway for yourselves, what you're going to do when you grow up. And for many of us, when we stay open to opportunities and begin to mature, knowing ourselves, our abilities, our desires, our beliefs, our capabilities, our thoughts, our feelings, our attitudes, and our not me self, you end up a lot of times in another dream. And while I never saw myself from Denton, Maryland, going to medical school and becoming a doctor, Dr. Ed Trachtenberg did. Dr. Trachtenberg was my organic chemistry professor at Clark, and pulling me aside one day after class to suggest I consider going to medical school changed my career trajectory. Thus, you have the sample of my resume, a little sampling of the accomplishments as outlined in the introduction, part of a 30+ page resume. It was my pleasure to get to know the more than 3,200 counties of the United States of America, and to be one of the first to hear the European Union's debut of health in all policies, that concept then brought back to the United States, to facilitate the implementation of the National Public Health Performance Standards over in Israel, to create the first public health systems research program at CDC and to bring youth into the mainstream of public health practice in Nashville, culminating in the opportunity to watch them grow in scholarly research and scholarly wisdom, and to be able to perhaps change someone's trajectory as well as Dr. Trachtenberg did with me. Our approach in Nashville regarding syphilis elimination in 1996, when we became the #1 city for syphilis, what we did, our strategy became the template for the national guidance that came out of CDC. So the accomplishments and all the lessons learned throughout my 40 plus years of service are all treasures in my heart. The next topic I was given was about insights into the many facets involved in changing the way people think in order to influence communities suffering from disease and disparities, etc. My first thought, no one likes change but a wet baby. I know I hear you laughing. I wish you were off mute. And then the other thing is there can be forced compliance, but preference is for internal change versus external coercion, because that will lead to greater sustainability of the change. The old adage of leading a horse to water but cannot make him drink is appropriate here. The horse will not drink. I will not drink until I am ready. And the readiness boils down to value, whether because of self-preservation or this new thing has been reconciled in my own thinking into my own personal belief system. You cannot move those unwilling to move. And you cannot force your will on people and call that freedom. The art of persuasion, however, is a powerful tool. It's keeping an open mind. It's listening, active listening, respectfully engaging, asking questions, challenging assumptions with rightness always coming first. Trustful information is key. Admitting that it isn't truthful is another key point. No one likes being fooled or manipulated into believing something you cannot make, and you cannot make equal one person's health to another, but you can create the environment in which people can be healthy. My topic number 3, how has the city of Nashville handled COVID-19? We are somewhat in the middle between those policies that were really, 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 really strict to the point of draconian maybe, and those that allowed the natural progression to occur with informed citizenry. Nashville locked down and had a mask mandate and phases for reopening. We moved through the first 3 phases out of 5 in a relatively short amount of time. And around September or October that we started to open, and we got to fully open about a month ago, and the mask mandate removed about 2 weeks ago. Some schools have been opened throughout the whole time in Tennessee. Nashville has done a combination of virtual, then going to school, then not going to school, then maybe we go to school. So not fully sure where the policy is, but there's been a hybrid of the school coming back. And now, there has been, of course, even with this middle road, there's been some economic failure or toll, but the bustling is back. The bustling is back as of a couple of weeks ago. So I'll stop there and wait for the questions. I'm looking forward to sharing more, particularly about my opinion about the beginning of the COVID.
Wonderful. Well, thank you, Dr. Bailey. And your point about coercion was really, I think we all saw that on display. The difference between sort of that internal change and that external factor. I think we saw it every day for the last 15 months, all around us and on television and Twitter and the like. So thank you once again. And now we'll turn to our last panelist of the night, Mary Owens. She'll share her perspective about her work as a communication strategist, again with CVS, and certainly all those different mediums, TV, radio, Twitter, all the different things that go into communication strategy. So Mary, to you.
All right, thanks, Garrett. And again, congratulations to Dr. Bailey. I loved hearing about your journey and seeing how you wear your joy for your work. It's just a wonderful thing to see. Clark asked me to talk a little bit about my role as a, communications strategist and what is communications role in public health during, a time like this, and what it's like to, communicate across different, aspects of the population. So I'll start with, my role as a communication strategist. So I've been a communicator for over 30 years. I worked across multiple industries, and my specialty is in strategic and change management, communications planning. So, whenever you work for a big organization, whether it's something that's happening inside the company or something that you're offering, to external constituents, there's an aspect, like Dr. Bailey said, of helping people, understand the change and then gradually come to accept and hopefully embrace the change. Not everybody, like she said, goes along with it, but there is certainly a science and a discipline to all of that. I started with CVS about 14 years ago. I started in their pharmacy benefit management business, but now I specifically support CVS Pharmacy. I lead the team that handles, broad communications to the public and to our own colleagues. And we have, within just CVS Pharmacy, we have almost 200,000 employees across the United States. We have 10,000 locations and about 1,100 Minute Clinic locations as well. So, so part of that is, media relations, and then, helping our own leadership team, communicate both to, our own employees and then also to the general public. So we've been obviously in the front lines of the pandemic this year, from the very beginning. We were obviously an essential services provider as a pharmacy, a very important role that we play in the healthcare, community. And then we're also a convenience store, and it's a place where, people rely on it to go in to buy, everything from, diapers and baby food to, something to treat, a cold or, whatever. There's a number of reasons people come into CVS Pharmacy every day. So, the pandemic, we experienced that pretty hard right from the get-go. But then as, things progressed, we actually took on a fairly leadership role in testing. We were the largest, retail provider of testing services in the United States. We ended up providing, over the course of the last roughly year, over 23 million COVID tests, through our drive-throughs, et cetera. And then, of course, the vaccination effort. we started out in January going into long-term care facilities, about 40,000 of them across the United States, and helping vaccinate patients and staff members so that they could, get that most vulnerable population, better protected. So, our role in public health generally, and during a time of crisis like this, it is really about, providing clarity and direction on, best actions to take. And I think that's especially important here in the United States. We have this extremely complex healthcare system. And so, communications plays such a big role in helping people, navigate through all of that. And I think good communications, they're credible, they're based on science and data, they're consistent, they're presented in simple language, they're timely and they're personal. And I think, as a communications team, we strive to kind of hit all of those things, as much as we can. I think the pandemic was particularly challenging because, we just didn't have a whole lot of time and we didn't have a lot of control. There were lots of external factors kind of influencing our business decisions and, how we talked about what we were offering and how we were partnering with like governments and stuff, et cetera. But like in non-COVID times, if you think about general examples of communications for public health, like the annual flu season is a great example of that. We spend a good amount of time, working to make sure that people are aware of the importance of a flu vaccine, that they know when the right time is to get it. We're very careful to be consistent with CDC guidelines on that. Making sure that they hear from local, as much as possible, from local voices about the importance of getting the flu vaccination for their health. And we kind of took that model and, built on it for the pandemic response, because I think when you communicate across, various populations, it's very people-oriented, discipline to be in, right? And, it's interesting. I was fortunate enough to host this panel discussion last week with our distinguished alumni and young alumni award winners about leadership. And they talked a lot about a couple of things that I thought, are actually very relevant to, the work that we've been doing in communications in general, good communications. Especially when you're looking at communicating to, very, very broad populations, one size just doesn't fit all. You have to start with empathy. People were scared and confused, and that manifested itself in different ways. Sometimes it came across as anger, in our stores, with our staff. And we had to really coach our employees to, take a step back and empathize, try to see, walk in other shoes and try to figure out where, maybe this person is coming from. Maybe there's something they're really scared about. And to take time to listen. The other thing that came through in that panel discussion was, to start actually with the most marginalized group. This, equity in terms of getting testing and vaccinations, was out into the public, was a very important goal for us and for many healthcare providers during this pandemic. And I think, what we learned along the way is that, again, that empathy and the personal touch at a community level and delivered by a trusted voice, a trusted local voice, is, the most, effective communications tool that you have. It's harder. It requires more arms and legs. We media trained, I don't know, like hundreds of pharmacists so that they were prepared to get on local, TV and radio and go out into the community and talk to people about how important it was to get the vaccine. And the idea was this, pharmacists are actually the healthcare provider that people interact with most. And so, seeing maybe hey, that's the local pharmacist I see when I go to my CVS, here he is, on the local news, talking about how important it is to get my vaccine or to get tested, et cetera, and how to do it. And is speaking to me in language that I can understand, and it has made it easy for me. And so I think it is a lot about, again, communicating across populations. It is about making it personal, meeting people where they are, making it personal, picking up the phone and calling people, and making them feel cared for, and making sure that they know that we see them. There were, we had quite a few outreaches for, again, marginalized communities with dedicated clinics. We offered free rides to and from, those clinics for people. And again, our pharmacists, often made personal phone calls. They would think, okay, I know this individual is probably in the age group who's eligible in the state. I want to make sure that they are thinking about getting the vaccine. And if I can make a personal phone call, I will do that. And I think that is, that is key, in communicating across populations in a time like that. So, I think in general, I think we probably weren't, everybody kind of goes into these sort of things thinking, oh, we're going to be prepared for this. You run all kinds of simulations in big companies, crisis communications simulations. And I'll tell you, they were not up to snuff, when it came time to actually do this. It has been an interesting journey. But one that we learned a lot from, and I think, again, underscored our role as a people-oriented discipline, who are there for thinking about, the constituents we work with, and making sure we're constantly walking in their shoes and thinking about what are they concerned about, how can we make sure they're informed, and that they know the best next step to take.
Awesome. Well, thank you, Mary. And you sort of, you touched on quite a bit there. And I think one of the themes running through that is something we had talked about even as before people were joining, but around that, the notion of sort of shining a light on health outcomes, on inequality in health outcomes, that the pandemic has exacerbated that. And maybe now shining a light to create an opportunity to do something about that. So awesome to sort of hear about the work and that outreach. I see in the comments about sort of the media trained pharmacists, and what a really neat opportunity that is for client relations. So now I'd love to open it up to questions. I know there's been a few in the chat as we've gone. A couple have gotten answered through a couple out along the way as well. Feel free
I have a question on the phone.
Yeah. Okay. Well, we have our first question then. All right.
Okay. So
introduce yourself as well.
Do you think has been learned from this pandemic that would help with future pandemics?
So I think that open to any of the four. I was going to say you can either call on an individual specifically or open it up to any of the four. But I guess I'll sort of look to folks to see what have we learned for the future.
I'll start. Having been in observance of this for many, many years, I was at CDC when SARS came through for the first time. And it was miraculous that we learned what the organism was and what the disease and everything was within 6 months. It was a tremendous sort of thing. I think this one, the key going forward is information that is truthful and as readily available as possible, because public health works best when we have correct information, not misinformation. And if it truly is a public health crisis, then the hue and cry should be for public health infrastructure, not for PPEs, the hospital beds, et cetera, et cetera. If there were a bunch of fires around, the fire department would, and it's a fire crisis, the fire department would be the first to be equipped. If there were, shootings and murders and things, you look to police. Well, everyone called this a public health crisis, and it indeed was. However, when I found myself being called back from Meharry over to assist at the health department on March 23rd, there was a new director. He just come in. We just had the tornado. He didn't know the organization. And fortunately, more than a third of the people were still there when I was there. But I found 4 epidemiologists, 4. This is March 23rd. This is infrastructure we're talking about, because in order to isolate, in order to assess, in order to quarantine and get a handle on an organism before it spread, you have to be out there. And so by the time it got to public health infrastructure, we found ourselves we got up to 180 in that time period, whereas if we were before, being overwhelmed. I think there are a lot of lessons learned, because there are a lot more stakeholders now in the pot. Who would have thought CVS would have been a critical stakeholder in public health practice? Who would have thought that SunTrust, Truist Bank would have been a person in now brought into, because this pandemic has destroyed or disrupted every organization, every entity across the board. So there's public health or the health of the public involved. I think where we will learn the best lessons is like Dr. Foley said, having those assessment sessions. What was it before? What is it after? And how do we go forth? And I'll just say one more thing, because the nature of human beings is that we forget. I remember being at the health department as director in 2006 before I went to CDC. We had just had 9/11, and we were compelled, every county, to do a comprehensive hazardous plan that covered everything from pandemics to floods to whatever. And if we did not do that, we would not have received our money from federal government. So we had these things, but we tend to forget. Everything is looked at anew. And when I got to CDC and the swine flu came on the scene, CDC loves epidemics, and everyone was ready for one. And I had to remind them just 2 years, why don't we test the plan that we put in place? It's just amazing. And it's human nature. So even if we learn the lessons well here, and I'm an optimist, it's the maintaining and the preserving and the renewal, like it never happened. I'm sorry, but I'm very passionate about this. Please don't ask me another question.
No, that's wonderful, Dr. Bailey, and I think it actually there's a question in the chat that I think leads to how to do that, and it's pointed at Mary directly, but in terms of working across those populations, how do you take what occurred in the crisis, implement that, and continue that going forward? So, as you said, Dr. Bailey, you're not in a position of forgetting. So that you don't put it on the shelf and it collects dust, and what can be done moving forward to help prevent that?
Yeah, I mean, I think one of the things that I think we learned most of all was how, complex a scenario like this could be. There were so many complicating factors. We had the federal government and the states with their own programs and timelines and, requirements for when you could get vaccinated, who should get tested and when. I mean, it was nuts. And then on top of it all, there were it was the politicization of a lot of the healthcare mandates that were coming down, which just created a lot of just general confusion for people. And so I think I think what we learned coming out of that is again, kind of going back to that whole notion of, media training pharmacists, and it's really about the local voice. And it's something that we implemented. When we started getting media inquiries in March, April to speak to a pharmacist, and I'm looking and I'm like, we have nobody media trained. We quickly ramped up that program, and I think it's something that we will keep going, because it is effective regardless of whether it's a pandemic or it's a local outbreak of whooping cough or measles or whatever. You need those local voices, because that's what people look to. They don't want to hear from the CEO of CVS. They don't. That person is not relatable to them. It is about their local healthcare providers. So I think that was one thing that we really learned that we'll take forward into whatever's to come. Hopefully not another pandemic, though.
Absolutely. Yeah. And I think, to that end, Mary, maybe a question for Jack and for Doug in terms of, Mary's talking about at the local level, right? In terms of crafting that message, supporting that message, being the face at the local level. How does this change Clark in that sense? And in that, how do you continue to drive that message home when, there won't be that scary pandemic hanging over everything, but the lessons have been learned? Who is the local presence on the campus?
Well, my reaction to that is that we've all been so proud of our students in terms of the way they've lived up to the Clark commitment. There was a lot of hand-wringing, Garrett, last summer among faculty, I won't name names, who really were concerned that if we were to open up and we were to have the Clark commitment, that the students wouldn't rise to the occasion. And then we'd have a huge disaster on our hands on campus. The community next door has not got the best resources available. But that didn't happen. And so certainly in my classes, and I know Jack sends out a weekly or biweekly email where he just congratulates particularly the students, because they are the face of our university, and they are at the front lines in terms of being able to combat this and to get through this pandemic, having really shortened our curriculum or our calendar by just 3 days in November. That's what we lost, 3 days, because of kind of an outbreak that we didn't feel we could control. It was pretty impressive, and our students are mainly to blame for that. I mean, the infrastructure that Jack and the health committee put together is crucial, and the testing is crucial. But if the students had decided to party hardy and ignore the Clark commitment and go on about their business, we wouldn't be here today. I'm on campus, or can be on campus. We wouldn't be able to be on campus. So I think it's the students who are the face of this battle, and the takeaway message is that they rose to the occasion, as you would expect Clarkies to do.
As Doug said, Garrett, the real unknown was compliance. We can put everything into place, but if people didn't follow the guidelines, then we were going to be in trouble, and all the schools are going to be in trouble. You can test as much as you want, but if people aren't adhering to the messaging and the steps to take to be safe, then you're in trouble. Our students have been great, and they have, because they wanted to be here. They were, the ones that were on campus last March, they went back home. It was very traumatizing for them. The high school students didn't have their graduation, the first year students. So people wanted to be back on campus. They wanted to be back learning in person. They wanted to be with their friends and their faculty. And so they really worked at this. And I think that's the message, is that if you raise the level of expectations for all people, they will rise to meet that expectation. I'm very proud of what the students have done here.
Wonderful. Fantastic, Jack. And I think Kevin posted in the chat early on the link to the Healthy Clark dashboard for folks that want to sort of keep an eye on what's going on and all the work that's being done, all the effort that's being put into that.
And I will say, Garrett, that was the most that had the most hits of any part of our website, that dashboard. Everybody checking it to see what the level of virus was and what was going on, and could they stay on campus? Did they have to come home? I think the parents looked at it all the time to make sure the students stayed here.
Wonderful. Well, I think I've gotten the questions that were through the chat. I know we're coming up on time. I don't know if there's one final question from the group.
I just wanted to share just a tremendous thank you. But I also have nieces that are in college, and they have not received any type of direction over the whole entire year in the pandemic. And it was shocking. And I wish I had been a little more able to. I did participate in a few alumni events that Clark had, like lectures. So I was really happy to see the virtual lectures. But I didn't know about all of this. But I'm just amazed. And I wanted to say thank you. But the collaboration just comes out over and over. The partnerships. I mean, that's something I've done in my work, but I know where I get it. The interdisciplinary thinking and the bringing those people together, and to see it and hear finally after such a hard year where I didn't know any of this was happening. It's anyway, it's a joy, and I just thank you all, and I'm inspired, and I hope to, maybe get a chance to work with you all, but not on another pandemic again.
It was funny, before we joined, we were all talking about how it was going to be refreshing to actually have a moment to talk about the work that we had done, and reflect back on it versus just, it was just constant do. And it is good to kind of think back and think about the collaboration and the multiple layers of that, and all the, all the players and people, and yeah, it does kind of harken back to all the great, the great things that we took away from our liberal arts, education at Clark.
Wonderful. I think what we all took away, and certainly, the opportunity to reflect on it has been wonderful. And I guess I'll close. I know I pushed time. Sorry, George. Sorry, Megan. But
actually, Garrett, can we get to that one last question?
Exactly. Yeah.
Awesome.
Velma asked the question about how Clark did interact with the community and maybe will interact with the community going forward. Probably to Jack or to
maybe
Doug.
That's a good Jack question. Yeah, in terms of
you mean our neighboring community and the city of Worcester, or more the Clark community?
You mentioned that.
Oh, I see. There it is, Velma. Oh, I got you. I'm sorry, I didn't see it there. Okay, I'm sorry.
Okay, you mentioned that Clark spent $9 million.
Right.
Okay, there's going to be federal funding available. How did you make testing available to our neighbors?
Yeah, we did not. What we did here, and we did this, we communicate with our neighbors probably on a monthly or every 2 months basis, letting them know what we were doing. But we did not open up testing to the neighborhood. It was really a surveillance testing that we created here on campus to try and maintain the low viral rate here on campus and keep the students from infecting others on the campus, but also from infecting others off campus as well. So that was the intent that we had going into this. There really wasn't the opportunity to put a lot of testing together for outside groups. It had to be our own self-contained unit. The tests had to be ordered by a physician, and that physician had to be connected to Clark, either with our students or with our faculty and staff.
Jack, the campus was also closed, wasn't it?
Oh yeah, the other part is that we set in place a number of different policies that would that closed the campus to any outside visitors. Students were not allowed to bring friends to the campus, or parents were not allowed to go to the campus and kind of casually go in as well. So we really locked down our campus as much as you can when it's an open campus. But we realized that students are still going to go into the community. shop at the stores, go to Annie's, go to other places. And so we wanted to try and make sure they were tested and that they were safe to go into the community and interact with our community residents as well as the Clark community.
Mm.
Well, thank you for that, those closing thoughts there, Jack, and thank you to all the wonderful presenters this evening, and thank you to each one of you for joining us. I'm going to build off of some of the comments that Jessica made there in terms of just the magnitude of the effort that was done, the work that was put into this, and of course, what we all have an opportunity to do as alumni to support that. So, quick message from the Clark Fund, reminding you all that we're in the midst of a virtual reunion, a little bit different than years past, but one of the really neat things going on right now is Reunion Rally. And it's a chance to double gifts, the impact of your gifts that are made during the virtual reunion 2021 time period that's being matched by a group of generous alumni that are all celebrating their milestone year. There's two major foci as it relates to the challenge. One being Clark Fund scholarships, which, as Jack alluded to, are so important right now, as well as internship and research support through Clark Connect. So two great opportunities through the Reunion Rally. Oh, perfect. Thanks, Kevin. I was going to say, I think we could put it into the chat, but for those that want to write it down, it's clarku.edu/reunion-rally. So you can find it there. You can find it at the link. And again, all gifts that are made before May 29th are counted as part of the Reunion Rally. So once again, Dr. Bailey, congratulations. Thank you. Thank you to all four of our panelists. Thank you to the staff who have put on the event and coordinated everything for us to get together, at least virtually. And as we always say on Passover, next year in Israel, tonight I'll say next year in Worcester. So hopefully we'll all be together. Thank you and good night to everyone.
That'd be great. Thank you all very much.